This year's 2010 Armed Forces Doctors' Conference focused on mental health in the military. With me to discuss this event is Dr Brendan McKeating, Chairman of the BMA's Armed Forces Committee. The keynote address from the Surgeon Rear Admiral Jarvis, the Assistant Chief of Defence Staff for Health, was very positive about the hard work of the Armed Forces doctors, but many military doctors will still be disappointed with the pay freeze announced in April. How do you think this has affected morale?
Well, this was effectively a pay cut, and I think many doctors in the armed forces will find it frustrating that they got 0% and the rest of the armed forces got a reasonable percentage. We accept it's a very difficult environment, but I think it could certainly have an effect on morale. It seems very odd that the Armed Forces Peer Review Body gave the juniors 1%, effectively mirroring DDRB, when that cadre is fully manned, when we're still looking at 20 to 25% undermanning for the accredited GPs and consultants. So yes, I think it could have an effect on morale here. However, I must point out that these are very professional people. They will still work hard and make sure that the troops are cared for and get the top quality care that they deserve out on the front line.
The Admiral was also asked about changes to the regulations, which mean that foundation doctors working for the armed forces are going to have to pay hundreds of pounds more each month to live in mess accommodation. What does the BMA's Armed Forces Committee think should be done to resolve this issue?
Well, we feel very much that these people should be entitled to live in mess accommodation at the reduced rate. We've written to the Ministry of Defence on several occasions, and we're still awaiting a reply to our inquiry. And we have been assured that they are investigating this policy and how it's being implemented. This really is a dreadful thing to do to young doctors who are just at the start of their careers with the military. They are actually being directed to go to these hospitals and to work there. They're in uniform, they're being paid by the military, and most of them are being involved in treating armed forces patients. So we would really like to see this issue resolved, and resolved quickly, because it is having a significant effect on our junior members.
Focusing on the theme of the conference, mental health in the military, why did you pick this particular area for the 2010 conference?
The topic of mental health was chosen for the conference because of the ongoing operations in Afghanistan. The conflict there is very intense. People are being exposed to significant amounts of stress, and certainly there's been a lot of controversy around this and around the issues of mental health of people coming back from operations. So we felt it was an opportune moment to deal with these issues and get relevant subject experts in, so that we could debate the problems that people are experiencing and how we might manage them.
So what was the highlight for you today?
Certainly listening to the American Brigadier General Cornum, who is working on mental health aspects of their own army, was very interesting, and I think gave us an insight into how the Americans are handling the problems that they have. She demonstrated the system that they're using to assess their soldiers and their predisposition perhaps to mental health problems, and then sort of showed some of the training that their people would go through to try and reduce the risk of them developing health problems. It was also interesting to compare it to our own trauma risk management system used by the British forces. Another highlight was hearing about the treatment of post-traumatic stress disorder, and then tying that in with the talk by Professor Wesley on what the British situation is like. And what is very interesting is the fact that in terms of numbers, actually the problem that people are facing most of all is to do with general mental health problems and alcohol, not necessarily PTSD itself. But obviously time may tell with regards to this, that it can take some people up to 12 or 13 years from leaving the service to present with their problems.
Did you get a flavour that the Britain's putting in enough resources to address the mental health difficulties of our armed forces personnel?
Well, when you look at the amount of money that the Americans are putting into to this issue, it's it makes what we're doing look small beer. But I think the system seems to be working well, because the problems are do seem to be thankfully small numbers at the moment. But I think certainly the trauma risk management, the TRIM system does seem to help. And I think people are much more aware of these issues, and despite the culture of not wanting to sort of come forward and talk about their problems, I think all of these initiatives will help to change attitudes and hopefully improve outcome at the end of the day.
Do you think we're storing up a time bomb for the future with mental health difficulties?
It has been said that we're just looking at the bow wave of a much bigger problem coming from within our own forces. But if you actually look at the figures that were presented today, that would seem to not be the case. But obviously, a lot of people, I think we were looking at something like, in true numbers, 180,000 people from the British forces, somewhere around that sort of figure, have deployed in Iraq and Afghanistan. So it may be difficult to tell when, we may have to allow time to see what happens with these people as time goes by.